Good afternoon. My name is Alex George. I'm one of the medical students studying here at Peninsula. Your doctor's asked me to examine your knees today. Is that okay with you?
Yeah, it's fine.
Can I just check your name and date of birth?
Yeah, it's Morgan O'Flaherty. It was May 92.
Okay, is it okay if I call you Morgan today?
It's fine.
Okay, what will involve is me inspecting these and look at them some movements. If it gets too painful at any point, let me know and we'll stop, okay? Do you require a chaperone when we're doing this? Okay, Morgan, if you could stand for me in the middle.
Inspect for scars, swellings, asymmetry, valgus severus deformities, quadriceps swelling or quadriceps atrophy.
And turn to the side. And away from us.
Inspect the posterior aspect of the leg, particularly focusing on epopliteal swellings. Causes include aneurysms and Baker's cysts.
And to the other side. Okay, Morgan, if you could walk to the door and back for me, please.
Focus on the speed, smoothness, symmetry, turning, whether it's fast and slow, and any signs of antalgia.
Okay, you comfortable there, Morgan?
Yep.
I'm just going to assess temperature first. Okay, now I'm going to feel joint lines and put my legs in together for me. Thank you.
Begin your palpation around the patella. In Morgan here we can see some patellar subluxation. Also palpate around the joint lines. And palpate the collateral ligaments. Partially flex the knee and palpate the joint line for meniscal tenderness. Make sure you're looking at the patient while doing this. Follow the same process on the other knee. Comparing in your mind one knee to the other. Palpate for popliteal swelling. Use your palm to milk fluid from the anterior thigh towards the patella. Keep tight hold of the thigh just above the patella. With the other hand, press on the patella with the 2 fingers. If fluid is present, you will feel a distinct tap against the femur. This is called a patellar tap and is used to elicit large effusion.
Okay, Morgan, now I want to do some movements to you, okay? So first of all, if you can put your heel to your bum.
Yep.
And down. Any problems there?
No.
Heel to your bum. And down.
Look for reduced range or pain on movement.
Okay, now I'm going to do it for you, okay?
It is important to place your left hand on the knee and the right hand on the ankle so that when you move the joint, you can feel for crepitations.
Now I'm going to do some special movements on your knee to test some of the ligaments, okay? So first of all, if you can bend your knees up like that, and the other one the same. Put the grips together, and sit on your feet, and this is to stabilise it, okay?
This is the anterior draw test. Your hands should be placed as seen. Pull firmly towards you from posterior to anterior. Laxity of the anterior cruciate ligament indicates a positive result, displayed by a forward movement of the tibia. This is the posterior draw test. Push away from yourself, from anterior to posterior. Laxity of the posterior cruciate ligament indicates a positive result. To test the collateral ligaments, we do the valgus or varus stress tests. These tests attempt to reveal instability to medial or lateral displacement within the knee. The valgus test involves placing the leg into extension, just simply by unlocking the knee, lifting it slightly from the bed. With one hand placed as a pivot on the knee, with the other hand placed upon the foot applying an abduction force. An attempt is made to force the leg at the knee into valgus. If the knee is seen to open up on the medial side, this is indicative of medial ligament and/or cruciate ligament damage. The varus test involves applying forces to the knee in the opposite direction, Widening the joint on the lateral side is indicative of lateral ligament and or posterior cruciate ligament deficiencies. Now to check for posterior cruciate ligament lag. To do this, we raise the leg and have a look at the angle of the knee. We check for hyperextension, which Morgan does not have.
Thank you, Morgan.
That's right.
That completes my examination. I'll report my findings to the doctor and he'll see you shortly. Is that okay?
Yeah, that's fine.
Thank you very much. Nice to meet you.
And you?
On examination. On inspection, the patient has no walking aids or knee support. There is normal distribution of wear and tear on the soles of his shoes. On close inspection, there are cuts and bruises on the anterior aspects of his knees bilaterally. On palpation, there was no increase in temperature or tenderness of either joint line. There was, however, bilateral patellar subluxation. There is a full range of active and passive movement with no crepitations. In terms of special tests, there was no laxicity or tenderness of the collateral, anterior or posterior cruciate ligaments. To complete my examination, I would examine the joint above and below as well as perform a full neurovascular exam. Thank you for listening.